Thank you everyone for coming in today. Today's discussion is going to be on the female cycle, and I've got a little cartoon here to start us off with. If you notice early in life, you have your regular cycles and everything is pretty hunky-dory and fine, and then as you move on into your late 30s and early 40s, you have your PMS cases getting worse and worse, and there's a cartoon depiction there of the first case of PMS. It's a woman strangling a Tyrannosaurus Rex. And then as you move into life, later in life, into menopause, we've got a little cartoon there that shows some of the symptoms: itchy, bitchy, sweaty, bloaty, sleepy, forgetful, and psycho. So we're going to begin talking about our estrogens. And in the female body, and men also, but in the human body, there's three types of estrogens. Estrone, which is known as E1, that is produced in the fat cells, and I call it old lady estrogen. And what estrone does, basically gives you some saggy skin and droopy breasts. It's old lady estrogen. The second type of estrogen is estradiol. That's shortened as E2. And it's produced in the ovaries. And during menopause or later in life, it can also be produced in the adrenal glands by the conversion of DHEA through a series of chemical reactions. This is a very powerful and active estrogen. And estriol is made from the conversion of estrone and estradiol, and I call that young lady estrogen, or the pregnant lady estrogen. That gives women that pregnant glow and healthy skin and firm skin. And that's really what gets lost later in life, that estriol. So estrogen has hundreds of functions in the body, and I'm just going to read these off pretty quickly. The development of sex characteristics, of course. It's used to the body. The body uses that particular hormone as a fat storage mechanism. The more estrogen a woman has, the more easily it is for her to store fat, and men also. It decreases thyroid function. Excess estrogen decreases the function of the thyroid. It's a checks and balances type of system. Estrogen is used in the growth of breast and endometrial tissue, development of the follicle to produce an egg, maintain collagen and connective tissue in the body. It inhibits vasoconstriction. Vasoconstriction is your blood vessels tightening up, increasing blood pressure. So the estrogens inhibit that. Again, checks and balances with the body. It decreases LDL, that's the bad cholesterol, and increases HDL, that's the good cholesterol. And when the estrogen is balanced, it'll lower the total cholesterol by about 20%. It inhibits what's called osteoclasts. Those resorb the bone back into the body. So when everything's balanced, it inhibits bone being absorbed. And it improves insulin sensitivity. In other words, it allows the body to use glycogen and glycogen for energy as it moves into the cell better through insulin. Another hormone is progesterone. It's produced mainly by the ovaries, and a large amount is produced in the second half of the menstrual cycle. A small amount is again made by the adrenal glands. The adrenal glands can also make progesterone, and it is completely different from chemical progestins. Those are prescription medicines like Provera and progestins found in birth control pills. Many conventional doctors and physicians believe that progestins and progesterone are exactly the same thing, and they are not. They are absolutely totally different. So some of the functions of progesterone: help maintain sleep patterns, calms down brain activity, just sort of slows things down a bit, lowers cholesterol, again, it's along with the estrogen when it's balanced, inhibits vasospasms. A spasm, like you get a muscle spasm, well, our blood vessels have small smooth muscles surrounding them. Sometimes it'll spasm. The progesterone inhibits that. It enhances thyroid function. Again, checks and balances with the estrogen. So it increases the function of the thyroid. Maintains a fluid balance by acting as a diuretic. When everything's in balance, progesterone will cause a release of fluid. Too much fluid means that you're out of balance. You need some progesterone. It promotes glucose utilization and improves insulin resistance. It improves on the insulin resistance. Again, that goes back to the energy cycle that we talked about with the estrogens. When glucose and insulin can be used properly, it lowers the resistance to the insulin that the cells will build up over time. It also helps the body burn fat for energy and promotes osteoblasts. Those are the cells that build up bone. So when everything's imbalanced, your estrogens are imbalanced. That prevents the bone from being reabsorbed by the body. And the progesterone, when it's imbalanced, it promotes the body to build up the bones. So it's also good for osteoporosis. It maintains the pregnancy. Progestins, like we talked about with Provera and the birth control pills, absolutely contraindicated in pregnancy. You cannot take them in pregnancy. Progesterone, you must have in pregnancy. Two totally different things. It opposes estrogen. Again, the checks and balances. The way I like to describe it is your estrogen is your gas pedal, progesterone is the brake pedal. You need both in your car to work. You need both progesterone and the estrogens for your body to be balanced. It regulates the cell growth and cell death. So it tells the cells how fast or how slow to grow and when to die. The estrogens tell the cells to grow, but you need the progesterone to tell them how fast and when to die. And it alters estrogen receptor sensitivity. Basically, when everything's in balance, everything is working right. If you don't have enough progesterone, your estrogen receptors are not going to be as sensitive to the estrogen that's already in your body. So even if you have the proper amount of estrogen, you're not going to feel like you have the proper amount because you may not have enough progesterone for those receptor sites on the cells to be sensitive to that estrogen. In other words, all the estrogen in the world isn't going to go into the cell and do what it needs to do because the receptor sites are not keyed in or not sensitized to the estrogen because of lack of progesterone. Xenoestrogens. These are chemical estrogens that are found in our environment. They're everywhere. There's no way to avoid them. So there's really not too much of a point in even trying to avoid them. What they are is they have estrogenic effects, but differ chemically from human estrogen. We'll just keep on reading here. They're difficult for the body to remove. Once they're in the body, they're not easily removed. I mean, we just said that. They stay in the body a long time, continue to act like an estrogen, and cause estrogen-like reactions in the body, but slightly different than our normal and natural estrogens. Chemically raised meat and poultry. What farmers do is they insert pellets of estrogen into the cattle, which causes them to get fat and the meat be more tender. Like we said earlier, too much estrogen causes fat storage. So what farmers do, they give their cattle estrogen, causes them to be fat, they get more money for their meat. High-fat dairy products contain these xenoestrogens. Pesticides and insecticides, plastics, cosmetics, sunscreens, food preservative, birth control pills, certain petroleum products, lotions, dyes. They're really everywhere. The only way to fight back is with some progesterone supplements, and we'll talk about that later. Estrogen dominance. Estrogen dominance is excess estrogen relative to progesterone. Now, usually what most people will call that is PMS or peri-menopause. It can be caused by 4 different things. Now you got to follow this. It can be caused by very high estrogen with high progesterone, high estrogen with normal progesterone, normal estrogen with low progesterone, or low estrogen, with very low progesterone. Basically, estrogen dominance is too much estrogen relative to the amount of progesterone. And the only way to really effectively determine that is to test. And then the most effective way, I feel, is by a saliva test. And the chart down below is just a simple representation of the female cycle. You notice estradiol is in red, progesterone is in green. That's mainly what we're going to talk about here. And the rise in estradiol in about day 9 or 10, 11 causes an increase in FSH and LH, luteinizing hormone, follicle stimulating hormone. That causes ovulation. Estrogen is supposed to dip down slightly, and the progesterone is supposed to raise up. Well, oftentimes, in the last 2 weeks of the cycle, prior to her period, a woman will not have enough progesterone. That's when you get the estrogen dominance, too much estrogen relative to progesterone. And you get those PMS symptoms or estrogen dominant symptoms. So what causes it? Anovulation, a lack of ovulation. When a woman does not produce an egg that particular month, her body thinks, for lack of a better term, okay, I don't need as much progesterone next month because I didn't get an egg. So the next month, she will produce a little bit less progesterone. And every time there's no egg produced, no ovulation, she will produce a little bit less progesterone and a little bit less progesterone over time, leading to estrogen dominance. Adrenal fatigue. We discussed earlier that progesterone can be produced by the adrenal glands. Well, if you're in adrenal fatigue, the adrenal glands are not producing that progesterone to balance out her estrogen. Her estrogen could also be being produced in her fat cells. So again, it's out of balance. Insulin resistance. That's a complicated situation. You get insulin resistance, buildup of glucose in the blood through a series of chemical reactions, so to speak, that can also lead to estrogen dominance because the body will be storing fat. In the fat, she produces estrogens. The conversion of testosterone to estrogens happens in fat cells. More insulin resistance equals more fat cells equals more estrogen equals estrogen dominance. Poor diet. Again, that leads back to the insulin resistance. The worse the diet is, the more fat is stored in the body, the more estrogen is being produced. PCOS, polycystic ovarian syndrome. What happens is she's producing an excess amount of testosterone that's being converted over into estrogen. Too much estrogen relative to progesterone. Oral contraceptives, again, anovulation. Oral contraceptives do not have that spike in estrogen, therefore an egg is not produced. So the woman's body says, well, I just don't need enough progesterone. So over time, that level of progesterone goes down and down and down, leading again to estrogen dominance. The symptoms, things that you feel for estrogen dominance, you may know it more as PMS. Anxiety, bloating, breast tenderness, decreased libido, food cravings, headaches, heavy menstrual periods, irregular periods, irritability, mood swings, PMS, there it is, and weight gain. Other things from estrogen dominance that you don't feel, you don't really know these are going on a month-to-month basis. Accelerated aging, fibrocystic breasts are developing, uterine fibroids are developing. There's an increase in triglycerides associated with this, increased risk of blood clots, increased risk of breast cancer, increased risk of gallstones, and ovarian cysts. These are all going on as the symptoms of estrogen dominance. Over time, these build up and build up and build up. The treatment for PMS. You want to reduce your dietary intake of alcohol, caffeine, salt, sugar, refined carbohydrates. Easier said than done. An increase in your dietary intake of fruits, vegetables, legumes, nuts, seeds, fish. Basically, a better diet. It helps with everything. Regular exercise, stress management, and you can lower your body's estrogen by taking a supplement called diindolylmethane, or DIM, D-I-M. And what that does is it assists your body in removing excess estrogen. It's an over-the-counter supplement. Supplements for PMS, vitamins, B-complex vitamins, 100 milligrams a day. Vitamin E, 400 to 800 international units daily. Magnesium, 4 to 800 daily. Calcium citrate, 500 daily. Some herbs that you can take. Vitex or chaste tree, black cohosh, and you see the doses there. What these are estrogen-like substances called phytoestrogens. They're very weak estrogens, and what they do is if you do not have enough estrogen, or you're just below the threshold, so to speak, what they will do is they'll bind to the receptor sites and give you enough estrogen to relieve your symptoms. If you have too much estrogen, too much of the more powerful estradiol and estrone estrogens, what these weaker estrogens will do is they will bind to the receptor sites and sort of fill them up, for lack of a better term, so that the more powerful estrogens cannot get into the cell. So again, it's attempting to balance it out. Again, in the DIM, the diindolylmethane, 150 milligrams twice a day to help lower your body's estrogen. Treating for low progesterone. The low progesterone is the most common reason for the PMS, or the estrogen dominance. You need to test with a saliva test, in my opinion, to confirm low progesterone. Actually, the saliva test is really the only effective way to get an accurate progesterone level. The blood test is just not accurate. Not enough progesterone is free in the blood in order to be testable. It binds too tightly to the red blood cells and it doesn't come off. So I don't want to say it's impossible to test for progesterone in the blood, but it's difficult, and I don't feel it is accurate whatsoever. Progesterone cream is over the counter. You can put 10 milligrams of cream twice a day on days 14 through 28 of your cycle. And you put the cream on your inner wrists and forearms and rub it together like any other hand cream or lotion. And you can adjust the dose and the days based on your response. And there's that cycle again underneath there. So if you're looking days 14 through 20 of the cycle, it's the last 2 weeks of your cycle. Day 1 is the first day of your period. So if you figure the last 2 weeks of your cycle is when generally the PMS symptoms begin, that's when you want to take that progesterone and try and balance out your progesterone level with your estrogens level. Peri-menopause and menopause. As we move on in life, begins around age 35, the perimenopause. And every woman is different based on her individual biology, lifestyle, and environment. The better she took care of herself when she was younger, the later this process will begin. She didn't take care of herself, it's going to begin earlier and be a little more severe. The cycles begin to fluctuate in length and severity, and it begins slowly. If she's regularly every 28 days like clockwork, heading into her mid to late 30s, she may find a cycle is 29 days, and then 27. And a couple cycles later, maybe go to 30 days, and maybe then a 26. It slowly adjusts and slowly changes, and that's perimenopause. And it begins with a rapid decrease in progesterone and a slower decline in estrogen. So our hormone levels are declining. So the symptoms of the perimenopause: getting older, aches and pains, mental fogginess, depression, dry hair and skin, fatigue, headache, hot flashes. That's probably the most common complaint. Short-term memory starts to go, incontinence, night sweats, bone loss, sleep disorders, tearfulness, and vaginal dryness. So some supplements for menopause. Again, pretty much the same dose of B complex for the PMS. 100 milligrams a day. Vitamin E, vitamin C, magnesium, calcium citrate, black cohosh. Again, that's one of the phytoestrogens that can help. And some vitamin D3, that's very important for anything. And you see your doses right there. Testosterone and DHEA. Testosterone is not just for men. Women have testosterone also. And it's secreted by the adrenal glands and the ovaries and can be converted to estrone. That's the old lady estrogen. Saggy skin, droopy breasts, the one that we don't want, or the ones that women don't want. Too much testosterone will get more conversion into more estrone. So you've got to be balanced. We say that word a lot, balanced. The testosterone improves the sleep quality. It also improves well-being, and it's essential for libido, arousal, and orgasm. Proper level of testosterone will decrease the amount of body fat and increase the bone density. Another supplement, testosterone is not over the counter, that's a prescription. A supplement that's over the counter is DHEA. It's important for libido and arousal. And it's good for a sense of motivation and well-being. In other words, your get up and go, so to speak. It improves your immune function, improves your sleep. And after menopause, almost all the estrogen in a woman's body comes from DHEA. The adrenal glands produce the DHEA because her ovaries have already shut down due to menopause. The adrenal glands are producing DHEA. The DHEA is being converted through a series of chemical reactions in the body to estrogens, and also to testosterone. Some of the symptoms of low testosterone and low DHEA, you just list them all there. You can see them. I'll just run real quickly. Low motivation, body aches, decreased mental clarity, decreased libido, sexual receptivity, and pleasure. That's one of the chief complaints, the main things that women, they're just not in the mood anymore because the low testosterone, low DHEA. Actually, with low testosterone, a decrease in muscle mass and stamina, diminished sense of well-being, increased risk of cardiovascular disease. That's because the heart is a muscle, it's pumping. So like a bodybuilder, they would take the anabolic steroids, the professional bodybuilders. Well, testosterone is the anabolic type, and your heart is a muscle. So low testosterone, the muscle isn't going to work as hard. So you got to get that back up to get your cardiovascular system functioning properly. Depression, hot flashes, memory loss, incontinence, arthritis, fatigue, osteoporosis, thinning skin, vaginal dryness, poor sleep quality, and dry eyes. You see the little chart, and that just shows the decline in testosterone in a female through the years. And you see at 20, it's roughly 75, and at 40, it's less than half. So replacing with supplemental testosterone through a prescription, or keeping herself in good shape and a healthy diet keeps that testosterone level up as good as possible. Symptoms of high testosterone. Too much of a good thing is not a good thing. Depression, disturbed sleep because it activates the brain. Now, you look at the picture there, she's the bearded woman. High triglycerides, increased risk of breast cancer, an increased risk of heart disease, PCOS, increased abdominal fat, increased facial and body hair, irritable mood, loss of scalp hair, and symptoms of high estrogen. Now, why would we think symptoms of high estrogen? Well, in our bodies, testosterone and DHEA are converted into the estrogens. That's just a series of how it works. So too much testosterone, you're going to get too much conversion into the estrogens, and you're going to get the symptoms of high estrogen. So what can a woman do now? Eat a healthy diet. That, it's, again, easier said than done. Decrease your alcohol. Eliminate caffeine. Easier said than done. Exercise. Manage stress. Sleep proper amount. And avoid synthetic drugs, birth control pills, and environmental exposure to the xenoestrogens. And I put an asterisk there because eliminating your exposure to the xenoestrogens is virtually impossible. You just can't do it in the world we live in now. And if you live a healthy lifestyle, it's going to help eliminate those excess estrogens from your body. And the exercise, manage stress, and sleep, that has to do with your adrenal glands that are going to be taking over your hormone production when the ovaries shut down. So they have to be in good working order and in good shape in order to lessen the severity of your menopause. So fixing the hormone imbalances, a saliva test with the basic hormone panel, that's the minimum. E2, the estradiol, progesterone is shortened to P4, and testosterone. Those are the minimum that you need in order to get some balance, to get tested for hormone balancing. And what I say is supplement the body's production of hormones with bioidentical hormones and support the system with a healthy diet, supplements, and exercise. Just because you balance your hormones doesn't mean you're going to feel good. There's other symptoms going on. There's other systems in the body that need to be fixed in order for you to feel good. As far as giving the hormones, give topical sex hormones. We term your estrogens, progesterone, and testosterone sex hormones. So give them topically. They cannot be swallowed. They don't belong in the stomach. The digestive system tears them up and puts stress on the liver. So topically, in my opinion, is the way to go. And evaluate and adjust the dose until balance is achieved. And I treat the patient, not the numbers. And we want to test minimum every 6 months because things change. Suddenly she'll decide she wants to go on a diet and exercise program. She loses 20 pounds in 6 months. Well, now she has less fat cells in her body, less fat cells producing less estrogen. So we need to supplement with less estrogen. Okay, and also if she gains 20 pounds, she's going to have more fat cells, making more estrogen. So we definitely need to supplement that and fix that because things are going to change. Use the proper supplements. MVI is a multivitamin. That's the shorthand. Omega-3 fatty acids, vitamin D, DHEA, digestive enzymes, and DIM, the diindolylmethane. Digestive enzymes, I think, are very important because our foods just don't have live enzymes anymore because we cook them out. That's just the way it is. That's our lifestyle. So we need to replace those enzymes that we had in our food 1,000 years ago that we just don't have anymore because they're processed and cooked. Balance the thyroid. That's very important to keep the system, the whole body as a whole, going properly. To balance that out, again, testing, and I prefer using the prescription product Armor Thyroid. You want to support the adrenal glands because those are going to be producing your sex hormones at menopause. And you support that with DHEA, pregnenolone, and hydrocortisone if necessary. That's a prescription product. You want to optimize your digestive system. So when you're eating these healthy foods that honestly are not the best tasting, you want to get the most bang for your buck. So you want to optimize your digestive system, mainly with the digestive enzymes and having a good, healthy diet. If you have any questions, there's the email address right there, and I look forward to hearing from you.